Hello, my name is Patricia. I am a certified childbirth educator at St. Clair Hospital, and I'm going to be speaking to you today about recognizing the signs of labor. You have been happily anticipating your baby's birth for months, but sometimes you're afraid of that special moment too. You worry about missing the signs of labor. Every woman's labor is unique. No two labors are the same, though there are some common signs that your body is getting ready to go into labor. Your body begins to prepare for labor up to a month before you give birth. You may not notice the introductory signs of labor, or you may notice some or all of them as your due date draws near. In the days or weeks before your baby arrives, the baby starts to descend into your pelvis. This is called dropping or lightening. Lightening can occur weeks before the onset of labor or any time up to the start of labor. When lightening occurs, you will be able to breathe more easily again, but you may feel more pressure on your bladder. During pregnancy, a thick mucus plug in the cervical opening prevents bacteria from entering the uterus. When your cervix begins to thin and relax, the plug is dislodged. This plug is actually stringy mucus that can be clear or blood-tinged and is sometimes called bloody show. The mucus plug may be dislodged minutes, hours, or days before labor begins. Not all women will notice this sign. The amniotic sac is a fluid-filled membrane that cushions your baby in the uterus. Either at the beginning of labor or sometime during labor, the membranes rupture. This is also known as your water breaking. When your membranes rupture, you may feel a continuous or intermittent trickle of watery fluid from your vagina. 1 in 10 women may feel an actual gush of fluid. Most often, a woman's water breaks when she is in active labor and already at the hospital. If your water does break at home, you will need to contact your healthcare provider to determine the next steps for you and your baby. Many women experience a burst of energy in the last weeks of pregnancy. They're cleaning the house, finishing projects, organizing closets, and freezing meals. This is referred to as nesting. Don't overdo it and don't wear yourself out. You need to conserve your energy for the work of labor and delivery. In the last month of pregnancy, your cervix begins to thin and soften in preparation for delivery. The medical term for this is effacement. Typically, the cervix is long and thick. It will become paper thin as it stretches to accommodate the baby's head. During your later appointments, your doctor will evaluate your cervix for thinning and softening. When your cervix is 100% effaced, it is completely thinned out and ready to dilate or open. At your weekly checkup, your doctor will also be checking your cervix for signs of opening. Cervical opening often begins days or weeks before contractions begin. The medical term for this is dilation of the cervix. Dilation is measured in centimeters from 0 to 10. At 10 centimeters, you're ready to deliver your baby. Noticeable, timeable contractions are a sign that labor has begun. The uterus begins to squeeze or contract to open the cervix and move your baby down the birth canal. When you begin to experience regular uterine contractions, this is the strongest indication that you are in labor. Contractions often begin with cramping or discomfort in your lower back and abdomen that does not stop with a change in position. How do you distinguish between true labor contractions and false labor? During the 2nd and 3rd trimesters, you may have experienced occasional, usually painless contractions. These are called Braxton Hicks contractions. These contractions are irregular and do not increase in intensity or frequency. They are most frequently felt in the lower abdomen. You can often stop these contractions by walking. If you are in active labor, your contractions will get stronger instead of easing up. They will not go away when you change position. They will follow a predictable pattern. They will start in your lower back and move around to your lower abdomen, hips, or legs, and they will progress becoming longer, stronger, and closer together. True labor will usually develop into a regular pattern, with your contractions becoming closer together. True contractions last about 30 to 45 seconds at the onset and become progressively longer, up to 75 seconds, and stronger. When your contractions are consistently 5 minutes apart, lasting for 1 minute for 1 hour, it is time to call your healthcare provider, grab your packed bag, and go to the hospital. Ask your doctor at your next appointment if he or she agrees with these instructions regarding when to call.